this, there will be a few announcements that I would like to make. So first, please mute your microphone throughout the whole session. Second, your attendance will be recorded once you join the session, and just this score will be issued to those who attended the session. And third, there's no sign-in and sign-up form. And then fourth, please complete the evaluation form on the last day after the closing ceremony. The link will be announced after the closing ceremony. And then number 5, you are required to turn on the camera for the group photo at the end of the session. And then lastly, remember to rename your Zoom name with uni followed with your name. For example, UTAR Kenneth. Okay, so now I would like to pass the session to Dr. Leong.
Thank you, Chairperson. Thanks. Hello, me again. All right. So this is the first session of your virtual mobility program. So I would like to give you a brief introduction regarding the medical education system in Malaysia. So I think the information that I'm going to talk about today is not foreign to our Malaysian student, but perhaps my talk can give you some brief introduction about what medical education in Malaysia to those who are not coming from Malaysia, right? So let me share my screen. Okay, can you see my slide here?
Yeah, can see.
Yeah, okay. So let me briefly introduce myself. I am actually, you can call me Dr. Leong. In practice, I'm actually a basic scientist. I usually teach in preclinical science phases, where I will be in charge to teach the student about immunology, right, and also community health project. So, here I would like to share with you some of the introduction about medical education in Malaysia. So this is my talk outline. So first, I'm going to talk about medical education pathway in Malaysia. Then secondly, regulation, how the medical education in Malaysia are regulated, which body actually doing the regulation and accreditation, right? And also, so those who are well known about medical education in Malaysia, we know, all of them know that we are actually facing some issues here regarding, like, we have a lot of medical school in Malaysia, even though our country is relatively small, right? We have quite a number of medical graduate coming from local or international. So these are the issues that we are facing, and we are still finding ways, you know. I hope in the coming near future that those issues can be resolved soon, right? And then I will briefly introduce the medical education in UTAR as an example to illustrate how the course structures, you know, how we actually design our program. Then second last, I'm going to talk about one of our exciting project here. We are actually, our UTAR is going to build a non-for-profit private hospital, which is called UTAR Hospital Project. So I'm going to brief you on that as well. And lastly, I'm going to talk about the medical education, you know, how during the COVID-19 pandemic, what adjustment that we have made to ensure that the student can continue to learn, you know, despite the COVID pandemic, whereby the students are not allowed to attend physical class, or the students have limited access to the clinical skill training. So what adjustment we have made, you know, during this period of time. Okay, so to start off with my talk, I'm going to talk to you about the medical education pathway for Malaysian. You know, if those who would like to study in Malaysia to get a medical degree. So after they finish their secondary school here, or O level as the international standard. So here in Malaysia, we call it as SPM. So after they finish the O level of secondary school, they have two different choices whereby for their PU program, either they continue to study PU program like A levels, or to obtain the SAM or one of the public examination organized by Malaysian government is actually STPM. So they have to follow the PU program for about 2 years, get the certificate, get the results that eligible them to enter for the medical education. So those students who don't want to proceed with the PU program, they can actually go to individual university to do the foundation of science study. You know, foundation of science study usually lasts for 1 year, right? So basically, quite a number of students actually prefer to go for foundation of science study before they can be enrolled to the medical course, because the time for the foundation of science actually only for 1 year, whereas for the PU program here actually is mainly like 1.5 years or 2 years. So in order to save the time, most of the students would like to, you know, will choose to go to the foundation of science. So for the foundation of science, the student must at least score about CPGA 3.0 as a result for their foundation study in order to make them eligible to continue with the medicine program. So, so in medicine program in Malaysia, most of the time is about 5-year course, is a 5-year course, and different medical school, they may have different course structures about how they are going to deliver the content for the MBBS program. Okay, but however, the content, you know, whatever structures they use, whatever program they use, the content of the medical program must actually consistent with what are being stated in the standard by set by the regulatory bodies, which I'm going to brief you all later. Okay, so after the student finish a 5-year medical program, then they are before they are not yet a medical doctor, because they need to go through another training again, housemanship training in the hospital. So during this housemanship training, the medical students are required to undergo rotational kind of attachment to different major department, for example, surgery, PICS, you know, ONG. And during their housemanship training, so they will be guided by consultants, you know, and they will need to sit for exams, you know, being assessed by their senior MO. Okay, so after they have passed one department, and then they need to proceed to another department. So usually the housemanship, the duration is about 2 years, right? If they actually not doing good in certain department, they need to extend their duration of housemanship in a certain department, which may extend their duration of housemanship. So once they have passed their housemanship training, right, they are considered as a certified medical officer. You know? So as a certified medical officer at the moment in Malaysia, because of high number of medical officers in Malaysia public hospital, so now this medical officer here is not being absorbed to the public hospital automatically. So it depends on their actually performance during the housemanship. If they are they have a very good performance during housemanship, most likely they will be given contract to continue to service in the public hospital as a medical officer. Otherwise, the medical officer will have to, you know, come out to the real world to ask, look for job, you know, as in the private sector, right? So as a medical officer, you usually the medical graduate at this point of time either have an option to further their study in the postgrad study in different area. So there are 2 paths here for our medical graduate to continue their postgraduate study here. Either they can study master in the public university, or at the same time doing a parallel pathway with the external exam, right? So usually the postgraduate study for specialization in Malaysia actually takes about 4 to 5 years to finish the whole course. And then at the same time also then we need to do a supervised training in the local hospital, and normally it takes about 8 years to complete the whole cycle of the specialized training in Malaysia. And of course, to do the postgraduate study, it comes with the cost. So the school fees that it needs to complete the whole specialization training actually is not a cheap, come with a cheap price, right? So this is the educational MBBS education pathway in Malaysia. So the education, the medical education in Malaysia actually is regulated by the following 3 bodies: Ministry of Education, we have an agency, Malaysian Qualification Agency, and also Malaysian Medical Council, to monitor the standard and quality of the medical education. So, so the medical education of Malaysia, actually, we are actually structures our medical program according to this standard, which actually draft and published by the MQA and Medical Education Council. So it's called Standard for Undergraduate Medical Education. So we have just updated the standard and just released last year. So the purpose of this standard is actually to ensure that the medical education that we provide to our students actually are able to produce and are able to help the community or the country to provide a safe and competent healthcare service for the country. So we need to produce a group of safe and competent healthcare providers, right? That's why we would like all the medical school who provide the medical education to adhere to the standard, so that ours, the medical graduate actually at the standard, and they are safe, they are competent, right? So briefly go through some of the content of the standard for the undergraduate medical education version 2019. So this standard actually first developed in 1998. Now, subsequently in 2020, this standard has been reviewed, and in order to align with the World Federal of Medical Education Global Standard in Medical Education. In 2018, with the standard further review again to in line with the most recent development in education and also advancement in the technology. So, so in this 2018 standard, the teaching, the delivery of the medical education, usually we focus on student-centered learning, okay, and student active learning method. You know, we in this particular standard, we emphasize on student-centered and student active learning, and also outcome-based education. Okay, this standard actually covers 7 aspects related to medical education. We actually monitor in these 7 aspects. They monitor the program development and delivery, how the program are being developed, okay, whether it has been monitored constantly, and how it's being delivered, you know, what teaching method are being used. Okay, assessment of the student learning, you know, how the students are being assessed, what assessment method are being used, you know, because different assessment method, then we have different objective, and we actually assess different learning domain of the student. So the assessment method actually it depends on what are the content that we would like to assess to student, what are the skills that we would like to assess to student, right? The standard also talks about student selection and support service, what kind of support service that we provide to the student, and what is the criteria to enroll a student into the medical program. So all these are being spelled out clearly in the standard. Academic staff, what is the qualification of the academic staff should be enrolled or should be employed to teach our medical students, you know? Then educational resources, okay? And what kind of educational resources we should provide to make sure that our students actually have enough training before they are being grant the certificate as a graduate medical professional, right? Program management, how we manage a program, okay? Program monitoring, review, and continual quality improvement. So even though we have a program ready, we must have a procedure and process how we should continuously monitor and review our program so that the program actually up to date and we address all the issue and all the pitfall that we may have during the implementation of the program. Okay. So the program learning outcome of the MBBS education in Malaysia must actually cover and emphasize the 5 learning domains as stated by the Malaysian Quality Framework 2.0. So the learning outcome should emphasize on the knowledge and understanding, the training of cognitive skill, critical thinking skill, and the functional working skill. We must actually emphasize on practical skill, communication skill, digital skill, numeracy skill, whereby the student need to learn how to make use of the technology software to do analysis, to interpret the data, leadership, autonomy, and responsibility. So these are the functional working skills that we have to embed into our program to make sure that after our program, after our graduate finish their study in a certain medical school, they actually acquire all these functional skills. And at the same time also, our learning program learning outcome should also emphasize on personal entrepreneurial skill and also ethics and professionalism. Okay, so these are the 5 learning clusters that we normally all the medical program in Malaysia actually will put their emphasis on. Okay, so this is the brief framework about undergraduate medical curriculum in Malaysia. So altogether, we must actually at least fulfill 6 of these important points here. The first one is early contact. We must ensure as our program, the medical program actually allows early contact with the patient, right? So for example, you may actually, some of the school may have the contact with the patient even starting at the preclinical year, even year 1. Some of the school may actually want the student to actually have finished their basic knowledge in basic theory in medical science, but then only they start to have a patient contact. But even though different school, they may have different way in design their medical program, but all in all, we actually emphasize on early contact with the patient, and the contact should be increased in duration, and also the responsibility of the student when they see the patient will be increased throughout the 5 years medical program. Perhaps during the first year, they will just look at the sign and symptom. Second year, they may start to actually having a face-to-face interaction with the patient. And finally, in the 5th year, they may need to actually follow the patient throughout until they, from their admission until they actually discharge, and when they become healthy. So the patient contact is very much emphasized in our medical program, right? So the medical program should able to cover most of the major discipline of the medical science, for example, GP, medicine, OMG, and PITS, in various settings and on various diversity of patient group, right? And we must provide experience for the student to following patient through their care pathway, like what I mentioned, we should have a module, to allow the student to follow them. That's why the student have to do intensive clinical training in the hospital, starting from in their clinical years. They need to follow through, from when the student actually admit to the hospital until they discharge, and until when they come back to the home also, they need to do a home visit to make sure the patient actually follow what being advised by the medical officer. Right. So, and we also urge to provide opportunity for our medical students to understand the needs of the patient from diverse aspects, right? The different social background, cultural, and ethnicity, as well as a patient with a range of disability, illness, and condition. So our program should able to provide all these opportunities. And the program should provide a platform for the student to integrate the basic and clinical sciences. Now here actually one of the method that we do, actually we have a task-based learning method as well as problem-based learning method to allow the student to help the student to integrate the basic and medical sciences. Development of clinical and practical skill through technology enhanced learning opportunity before the actual skill are being practiced in a clinical setting. So normally before we allow the students to actually have real contact with the students, with the patient, sorry, and we will normally make sure that the medical students are being trained before, they practice their skill in using stimulators in the skill lab. So make sure they are being briefed, they are being trained before they are allowed to have a hands-on practice on the patient to ensure the safety of the patient as well as the student as well. So these are the brief introduction about the framework of undergraduate medical curriculum, where these are all the items that should include in their in their program design. Okay, the curriculum content of the medical program in Malaysia actually must emphasize all of these items listed here, and the curriculum deliveries should be delivered either horizontal or vertical integrated manner. So all in all, after the 5-year program, the student should actually acquire all this knowledge listed here, including the biomedical science principle, all the basic medical science like anatomy, biochemistry, physiology, pharmacology, and behavioral, population, and clinical science relevant to healthcare, and emphasize on adult as well as children. Clinical skill, starting from medical history taking, physical examination, mental state examination, formulating diagnosis and management plan. Right. So acute care skill also is very emphasized during the emergency posting. Right. So these are the whole list of medical science discipline that the student may need to acquire throughout their 5-year medical program. I would like to emphasize here during this the curriculum of medical education in Malaysia. We very much emphasize on ethics and professionalism, whereby we actually let the student know what is ethics and professional that they must hold when they carry out their duties later on, right? And also research. We always know that research is the only way that we can actually develop get our current situation become better. Research is one of the components that we pretty much emphasize here in our curriculum design. So during when we plan for our research, normally we expose to our medical student the scientific method, how is a proper way to do research, how to critically appraise and look at the literature, published data, how to actually check or verify whether the data being published is actually authentic, or how can we actually further improve the study to meet the objective of our current community. Right. Okay, so in the standard also we emphasize on effective delivery of teaching and learning method, the effectiveness of teaching and learning activities. So therefore, in the standard also they emphasize like the ratio between teacher and teacher and student ratio must actually being maintained on certain teaching and learning activities. For example, like if we are going to carry out tutorials, the tutorial should have student and teacher and student ratio at 1:16. So if our class have 50, we have to divide our student into a few small groups in order to carry out the tutorials. So problem-based learning 1-12, bedside teaching 1-8. So if the class have a lot of students, then we have to divide our class into small group. Only 1-8, one lecturer is only allowed to teach each student at one time. No. However, lectures, team-based learning, fixed classroom, the number is unlimited, is up to, we can conduct the class as a whole, in a lecture theaters. So as I mentioned just earlier on, in Malaysia, even though our country is relatively small, and we have 38 medical school registered with the Ministry of Education. So consider a small country in Malaysia, this number is considered quite big, right? So yearly, these 38 medical school actually produce about 5,000 to 6,000 newly graduate medical students into the country. So all these students, newly graduate students, actually they are facing some dilemma here, right? So what are the dilemma that we have in our medical education in Malaysia? So the first issue that we face actually is inconsistent quality of the medical students, right? So as you all know, we have quite a number of medical school found in Malaysia, 30 of them. At the same time, also Malaysian government also recognized medical degree from overseas. So because of this enormous amount of medical graduate coming back to Malaysia for their training, housemanship training. So because they are trained in different background, different structures, their quality sometimes is actually not consistent, because different school, even though we have a standard to follow, but different school, they may have their own way to deliver the program. So therefore, the quality is actually not really assured, not really consistent. Sometimes we may have foreign students, especially from the foreign medical school, and where their quality is actually because they are being trained in overseas. So when they come back to the Malaysia for their practice, so sometimes the cultural and societal issue. So it makes them actually very difficult to adopt to the Malaysian healthcare system, right? So therefore, because of this issue, we have quite a high percentage of officers not able to complete their housemanship training within 2 years period. Some of them even drop, in the middle of the housemanship training. So in 2019, just one example, in 2019, we are reporting about 1,000 HO failed to complete their HO training in 2 years period. And because they are not able to complete their training in the stipulated time, and therefore their seat cannot be vacant for the newcomer. So the new graduate have to wait until they finish their housemanship training, then only they can start their training. So that's why it's delay, and it makes the new graduate student have a long waiting time, to start their housemanship training. So the second issue that we face actually is high number of medical school and medical students. As I mentioned, we have 38 medical school and produce about 6,000 medical graduate annually. And we only have around about 12,000 housemanship slot at the moment for the medical graduate. And definitely is not able to cope with this number, and the condition even being worsened with the high retention of HO, the high percentage of HO, they are not able to complete their HO training in 2 years' time. So usually the medical student have to wait up to around 9 months before they actually get the housemanship training, right? And also because of high number of medical school, and in order for the medical student to have enough medical training during their medical program, the student need to actually go to the hospital, dedicated hospital, to do their skill training, and so they only a certain number of public hospital have the capacity to actually allow the student to have their skill training. So the slot also quite limited. So it actually boil up to the overcrowding of students in the training hospital. So it will actually reduce the learning opportunity because the student come in a big group. Okay, so the hands-on experience is actually quite low, and at the same time also it poses a tremendous stress to the patient as well, because the patient, one patient have to be examined by multiple, a lot of students, asking them the same question over again, because the student need to practice and the patient will be very tired. So these are some of the issues that we are having here, right? So the other issue is oversupply of graduate, medical graduate. So I actually put oversupply as an inverted comma here, all right? So this oversupply actually is true or not true, right? It's because we actually seen an unequal distribution of medical graduate across the nation, because most of our medical graduate actually prefer to actually stay put in the urban area, in the big city, and therefore we see oversupply in the urban area, in the hospital. Okay, everybody actually fight for a slot to be trained in the urban hospital, citing that the case is a lot, that can have more exposure. And we see a shortage of medical officer in the hospital in the rural or suburban area, because those are not a favorable spot for the student to have their training or provide their service there, because perhaps because of they prefer an exciting urban life. So oversupply here only mentioned to the urban area, but not so true regarding those in the rural area or in the suburban area. Okay, and at the same time, even though we have a lot of MO, we produce quite a number of MO, but our country actually reported a chronic shortage of specialists in both public and private sector. So in 2007, we only have 7,000 specialists in the whole Malaysia. So most of the time, the MO, after they have finished their housemanship, they become MO. Not many of them actually will continue to be trained to become a specialist. That's why this is one of our issues, how we should encourage, our MO to pursue their study, to become a specialist. So this is one of the issues that faced by the Malaysian education, medical education sectors. Okay. Also, and because the medical graduate like to crowded in certain urban areas, so we have limited number of ASO training center. So that's why it is boiled up to like a long waiting time for the HO training, about 9 months. Okay. The other thing is actually it's actually come to the why we have a shortage of specialists, because like now I mentioned, as I mentioned before, we have quite a number of medical students, 6,000 of them. So starting from 2018, that time, the government actually has already stopped, the setup of the medical school. As well, also because the hospital are not able to absorb all the medical officer in their public hospital, so they have turned the HO and MO to become a contract basis, whereby only those HO who perform at excellent level will be absorbed as a medical officer in the public hospital. So that's why this particular policy actually hinder the training of the medical officer in our country, because in 2020, according to their report, only 50% of the HO has been absorbed into the public sector, and the criteria where how and the contract are being given to this particular MO is actually questionable. The selection criteria is not clear, it's very ambiguous, right? So also in 2020, we reported that about 23,000 of the MO in Malaysia have yet to pursue specialist training, and most of the time why they haven't made the decision to continue their specialist training is mainly because of financial issue, because the government, because of certain issue, they actually have very limited financial support to encourage the MO to pursue their specialist training. So as you already know from my earlier presentation, the specialist training actually takes about 8 years to complete the whole cycle. So the fees to attend all this exam and to attend this training is actually not cheap. So without the financial support, properly structured financial support, so some of the MO may not able to actually make their decision to start the specialist training. That's why we have a very limited amount of MO to decided to continue with the specialist training. So these are some of the publications throughout the years that talking about what is the issue that we in Malaysia, in medical education in Malaysia actually are facing, okay. So there are actually some voice also asking, help the contract doctor to have a better future, because at the moment, the HO are being issued a contract. After their 2 years, their future is actually quite uncertain for them. So the several groups of medical professionals actually asked the Malaysian government to actually consider how we can actually encourage the young medical doctors to actually how to boost up their trust, so that they can have a better career choice in future. Okay, also the other group as well, they are talking about reform the Malaysian medical education system. Looking at all these issues that we face, we should really seriously think about how we should reform our Malaysian medical system, and how actually we should review our content of our medical education to ensure that we can close the gap on certain training. So make sure that our medical students actually being trained with all the necessary information, so that they can provide a better service to the society. Right? So how, these are the suggestions that are being shared by most by various parties, and to how we should actually address the issue faced by the medication currently. Right. The first one is we should seriously think about tighten and the regulation and accreditation guideline of the medical school. We have 38 of them. So with some of the medical school, despite being warned about their qualities, but because of certain reason, they are allowed to continue to operate. So hopefully we are actually call for a tighten of regulation to reduce the number of medical school. We only retain those medical school with high quality, right? So since 2018, for the last 5 years until 2021, the government actually has already stopped, to allow, given license to allow medical college to be set up. No new medical program, no increase in the quota of medical students. So the target actually, the ideal target actually is to have 2,500 to 3,000 medical graduates per year. If we can achieve this, then we may able to solve like the medical student have to wait for long time before they can start their HO, right? So this is one of the target that we people has actually suggested, different group have actually suggested for the government to consider. All right. So the other thing is actually to improve the selection of medical students, and because at the moment we actually have a guideline, to say that at what qualification a student can be enrolled as a medical student. But that particular guideline is actually rather general, because as you all know, our education in primary school or high school as compared to the medical study is totally different things, So that's why many suggest actually we should actually have a standardized selection of a medical student. Perhaps we should have a single entrance test, and those who have a high score during the examination will be enrolled to different medical school, to pursue as a medical professional after they're completing the course. And also, they also suggest like to actually engage, specialists from the public hospital in teaching. Most of the time when the student actually go and have hands-on training in the hospital, and some of them they may, because only one or two lecturer are being, not all the lecturer who are involved in the teaching even can actually have access to the patient. So this make the student very difficult to actually communicate and also have a hands-on on the patient. So if we engage the specialists who are working in the public hospital in teaching, so it will increase the chance of the medical student to expose to wide variety cases or patient in the hospital, and also help to lessen the burden of the teaching staff from a particular university. And one of the suggestions also is actually to have an innovative teaching strategy to deliver the medical education knowledge. And the old school, like asking the student to memorize the facts and regurgitate in the exam, actually is not relevant anymore in this modern society, because we have so many information out there in the internet, in the virtual platform. So we must actually teach our students how to appraise all those information, okay, how to process those information, okay, how to make use of all this information to their own benefit. So we must actually help to train the student their clinical skill, how to develop their skill in terms of data processing and also critical skill thinking. Right. The other suggestion is actually the point that highlighted is actually doctor is not just a diagnostician anymore. You are not there to just treat the patient. You must, the doctor must be well-rounded, in all aspects. When the patient come and talk to you, they expect advice from you at different angle, whether even at interdisciplinary advice also, they will expect you to give them, for example, what kind of nutrition they need, you see, whether complementary medicine is good for him, right? Whether if I only this amount of money, what kind of best treatment that I have. So the doctor must be well-rounded and well exposed to different kind of knowledge so that we can provide a good service to our patient, right? And the doctor should be able to work, to have a good teamwork spirit, because you need to work together as a team with your colleagues as well as healthcare provider of different disciplines, for example, physiotherapists, nurses, complementary medicine doctors, etc., lawyers, all right. So all these new knowledge, the doctors must have some exposure on it. And the other thing, talking about engaged private hospital for HO and specialist training. So at the moment in Malaysia, most of the medical training for HO, for undergraduate medical students, they are being done in public university or public hospital. Because they say that only certain number of only hospital with certain number of patient load and cases are allowed to become a hospital for the training of HO and medical students. So that's why the slot for the training is quite limited. So therefore, there is a call here to allow private hospital to become the training hospital as well. So, and moreover, about 40% of the specialists registered in Malaysia actually working in the private sector. So, if we can engage, private hospital in terms of training our HO, it will be good for us, to lessen the burden in the public hospital. But again, in order to engage the private hospital in the training, there are a few things to be considered. For example, like private hospital, as we all know, their organization and their mission of the organization is pretty much different from the public hospital. So we must actually have a delicate, discussion with them, see how we can achieve a win-win situation if they agree to actually provide this particular platform to train the HO and medical students. And also, because the private hospital, their emphasis is actually different from the public hospital. So we also must understand their level of commitment. If they commit, what is the level of commitment they have, in terms of providing the platform for this HO and specialty training. Right? And there is a call also asking those institutions who actually have a medical program, should actually set up their own teaching hospital. So that these are the 5 advantage, that actually talk about if you have your own teaching hospital, what kind of you can have, like to what kind of benefit you have. The first one is actually the demand for HO and PG training in the public hospital. So we can divert some of the training from the public hospital to our own teaching hospital. So it will ease the demand. At the same time also, if we have a teaching hospital also is a hospital to provide service to the public. So therefore, if you have a teaching hospital, then you create job opportunities for perhaps a new graduate as well as other healthcare professionals. And to reduce the patient-student ratio, because if the teaching hospital only train our own students, not many students are then crowded there to actually fight against talking to the patient. So the student will have a better learning experience, whereby they have an ample of engagement, opportunity to communicate with the patient, as well as for the patient itself, also good for them, because they are more relaxed, they need not to answer the same question again over to different students. Less stressful to the patient actually. And if we have our own hospital, then we have a more control over the teaching arrangement. Need not to depend on the management from the other public hospital. And better hands-on opportunity. Have hands-on opportunity for the student from different field. If a particular university have a different program that are related to medical education, for example, business, engineering and information technology, these students can actually have a hands-on opportunity in the hospital to actually have a better understanding about what is required in the medical field, in terms of all these non-medical aspect. Okay, so next one, actually, I would like to give you an example of how the medical education are being delivered in our country. So of course, I will use the example from our UTAR medical program as an example to illustrate to you how we actually deliver the medical education in UTAR. Okay. So this picture actually show the city campus of UTAR in Sungai Long, Selangor. Okay, so this particular building here, in brown color, this is where Faculty of Medicine and Health Sciences are being situated. Our faculty is here in this building. So the building behind actually is called it as cabby block, is where all the administrative department are situated, and also the other faculty like Faculty of Engineering. So come back to Faculty of Medicine and Health Sciences. We are the faculty is young. We start our operation since 2009, 16 November. All right. So our mission is to become the preferred center of education and research for medical and health sciences. Okay, so this is the organization chart of FMHS UTAR. So in brief, we have 9 departments and 5 research centers. So out of these 9 departments, 4 departments here actually being tasked to deliver and in charge of the delivery of the medical program. These are Department of Preclinical Science, Department of Medicine, Department of Population Medicine, Department of Surgery. Out of these 4 departments, Department of Medicine, Population Medicine, and Surgery are the involved in clinical teaching. So they're involved in coordinating the clinical teaching in year 3 and year 5 in our UTAR MBBS program. Right. Okay, so we have 5 research cluster or center in our faculty, which consists of stem cell research, cancer research, non-communicable disease research, traditional Chinese medicine, and also communicable disease, right? And our faculty actually offer 4 undergraduate programs and 4 postgraduate programs. So the 4 undergraduate programs are Bachelor of Medicine and Bachelor of Surgery, MBBS, Bachelor of Chinese Medicine, Bachelor of Nursing, Bachelor of Physiotherapy. So the postgraduate programs are Master of Medical Science and Master of Medical Science Chinese Medicine, and PhD in Medical Science and PhD in Chinese Medicine. Okay, so here I would like to go through with you in detail how the MBBS program are being delivered in our faculty. So first I start off to talk about the entry requirement to our MBBS program in UTAR. So we actually accept students from these various backgrounds of high school, pre-U qualification, foundation, student with foundation with minimum CPGA 3.0 at CPM. This is the exam, high school exam equivalent to A levels. The student need to score at least B in the in this science subject. A levels UEC. So this UEC is actually the pre-U examination organized by the private secondary school in Malaysia, right? So SAM and CPU. So these are the entry requirement to our program to our MBBS program in UTAR. Okay, so when the student actually submit the application, so if the student actually met the prerequisite qualification, so the candidates will be asked to attend an interview as part of the selection process. So before we actually give the offer letter to the students, we will normally have a session to talk with the student first. So the objective of this interview actually is to actually understand the students' amplitude, their ability, and their motivation to pursue this degree, because we all know that MBBS study actually is a lifelong training career. So we would like to know what is the motivation of the students to choose MBBS as their career path, and whether these students have the amplitude, ability, to follow the course, and also to assess the student communication skill in English. Just for your information, for the MBBS program in UTAR, we actually use English medium in the course delivery. So the student, all the lectures and also practical and all the teacher and learning activities actually is being conducted in English, and the student also have to present all their work, doing discussion in English. So during the interview session also, we will assess the student English communication in terms of their speaking skill as well as their writing skill, so as to make sure that the student acquire relatively good command in English before, so that they can follow the course at no stress. Okay, so this is the program educational outcome of our MBBS program. So the aim is actually to produce knowledgeable and clinical skill competent medical doctors, and at the same time also the students should actually have acquired the entrepreneurship skill, analytical and critical thinking abilities, and lifelong learning, professional research activities, and also ethical value, professionalism, have moral responsibility. Okay, and the graduate should also have leadership, acquire the skill of leadership, how to work as a team, how to communicate with the patient, family, and their colleagues. So these are the program educational goal of MBBS program in UTAR. And these are the learning outcome. Altogether, we have 8 learning outcome for our program. Okay, so this is the overview of the course structures of the 5-year MBBS program in UTAR. And year 1 and year 2, is considered as the preclinical study, preclinical stage. Year 3 and 4 is considered as clinical stage. Year 1 and 2, during the preclinical stage, the student will do their study in the city campus, the Sungai Long campus, right? Year 3 and 4, these are the clinical phase, and the student have to attend their classes in the hospital and or in the clinical skill training center nearby the hospital, right? So these are the list of courses that being delivered in different years of study. So along the 5-year medical course in UTAR, we have 3 major final exams. The first one in year 1 is called first professional exam. So during this exam, if the student fail to pass the exam, they will be asked either to leave the course or to repeat the previous course again, right? Right. So in year 3, they will sit for second professional exam. In year 5, they will sit for final professional exam. Right. So along the during the course of during the 5-year program also, the student need to attend 3 elective posting, prior clinical posting elective in healthcare setting, like in TCM, but not in clinical, right? So in year 3, they need to undergo the general practitioner elective, and in year 4, they need to undergo the clinical elective. To do this elective, the student can either choose to do it locally, or if their financial is allowed, they can choose to do the elective in overseas institution, and the school will actually have a list of partner university or industrial partner that the student can actually choose to have their posting there, right? Okay, so in detail, in year one actually we have all the basic medical science, including anatomy, physiology, and also systemic pathology. Right. So in year 1, actually, we deliver all the core concept of the basic medical science, and followed by system-based learning process. Okay. And the mode of delivery in year 1 is actually rather conventional. We normally use lecture, practical session, and problem-based learning is being introduced starting in year 1 to help the student to integrate the theory-based knowledge with the clinical setting, right? And in the curriculum design of the in our MBBS program, we allocate a very generous sum of self-directed learning in our timetable, because according to the standard of the medical education in Malaysia, so we must at least allocate about 60 to 70% of the student's self-directed time to allow the student to have their time to go through the teaching material that being provided during the face-to-face teaching section. So that's why normally when we actually have our timetable plan for our daily teaching, the student face-to-face session, like lectures, practical session, is about like 3 to 4 hours, 5 hours like that. So the rest of the time, the time in the timetable actually is a self-directed learning, whereby the student can make use of all the online resources and also the lecture notes to actually do their own reading. If they have any question, of course, they can actually communicate, form a study group within themselves, or they can actually ask the lecturer during the face-to-face session, right? So this is year 1. In year 2, we actually have start to actually have basic clinical skill training to our students, in preparation for them to have a clinical training, full-time clinical training from year 3 to year 5 onwards, right? And at the same time, in year 2, we have a slot for the community health project, whereby the students will be asked to carry out a community health design and carry out a health community project in a selected target group. And after the community health project, the students are required to actually go back to the community and provide health promotion activities to actually inform the target group about their outcome, as well as how they can better improve their well-being, right? And also in year 2, we have all these course to actually better enhance their professionalism, like for example, professional legal and ethics issue. And also we have laboratory medicine. This is considered one of the unique features in UTAR MBBS program, because we have 8 weeks of laboratory medicine being scheduled in the year 3 program, whereby the student have a chance to actually take a visit to the clinical lab in the hospital, to see how how the clinical specimen are being processed, and also how to interpret the laboratory data in order to help with the diagnosis, right? So in the past, during laboratory medicine, actually, we are asking the student to have a few days posting in the clinical lab, but due to we actually constantly revise our program and based on the feedback from the student, and starting from last year, actually, we actually based on the feedback, we have actually revised the implementation of the lab medicine to emphasize more on the data interpretation, right, to cut down the lab visit. Okay. So in year 2, actually, we actually try to help the student to integrate the core knowledge that learned in year 2 into early clinical practice. So the teaching methodology in year 2 usually is like lectures, we have lab session, we have bedside teaching. This is just like once a week, in the last phase of year 2, that will have a regular once a week hospital visit, whereby the clinical lecturer will guide the students to actually observe the sign and symptom of the patient of a particular disease. They still haven't, the students still will not be given chance in year 2 to have a hands-on practice on the patient, but during in year 2, the student will start to have their clinical skill practice like history taking or examination using a stimulated patient, right? Okay, so move on to year 3. Year 3 actually the student will be divided into 5 subgroups, and they will do rotation in these 5 major departments, and at the end of each rotation, they will sit for end of posing exam, and at the end of the year 3, they will eventually sit for second professional exam. So in year 3, actually, is a full-time clinical training. They usually do their training in the hospital, teaching hospital, being assigned to UTAR, Ampang Hospital, and it's a clinical orientated student-centered teaching approach. Okay, so the teaching methodology in year 3 actually is bedside teaching, ward work and clerking, clinical skill lab practicum, and once a week the student have to come back, make a trip back to the Sungai Long Hospital campus to have their practical skill laboratory in the faculty, So we have stimulation ward practicum, task-based learning to discuss about different cases, And in year 4 actually is considered sub-specialist training, and altogether they have 11 posting on these different sub-specialist topic, including rehabilitation medicine, radiology, emergency medicine, and etc. So in year 4, the teaching learning methodology is highlighted above. One thing I would like to highlight is actually in year 4, actually the student under the course of family medicine, they will actually have opportunity to have an educational site visit to those underprivileged sector in the society. For example, the blind home, to visit to the HIV home, they will have a healthcare workshop over there, and they will also doing a home visit for the follow-up study of patient in the community, so that this is the learning method that we allow the student to follow up with the patient until during their care pathway, right? Okay, now we move on to year 5. Year 5, again, the student will have to revisit the 5 major posting in year 3. Again, the student will be divided into 5 groups again, and they will need to rotate. But this time, In year 5, the learning is more emphasis on the management of the patient as a whole, right? So that when they graduate as an MO, they can actually handle the patient independently in all angles. Okay, so in year 5, actually we emphasize on the fine-tuning of clinical skill and also learn of patient management skill. All right, so these are the teaching and learning methodology in the year 5 learning. So the clinical space training in UTAR medical students are normally being done in this setting, hospital Ambang. This is the major this is one of the major learning hospital for year 3 and year 5, year 3 and year 4. KL General Hospital is meant for certain posting in year 5 and also year 4. Okay, primary care clinic, community health service center. So during the posting, usually the student will be accompanied by clinical instructors. And these are the 3 elective courses embedded in our MBBS program. So the student need to attend this elective, and it will be graded as pass or fail. So only. Okay, so for assessment, actually in year 1 and in year 2, you usually we have, for each of the study block, we have continuous assessment and the final exam. So if in year 1, if the student actually passed the overall exam in year 1, they are allowed to continue in year 2. If they fail, they will given a remedial class. Then at the end, they need to seek for repeat exam. So if they fail the repeat exam, they are asked to leave the course. If they pass, they will continue into year 2. So in year 2, there are no major exam, as you have seen in the course structure just now. They are all continuous assessment. So even though that is the case, so the year 2 student, they have to score at least more than 50 in the aggregate marks in year 2. At the same time, so they shouldn't score less than 40 in either of these end of course assessment. If not, then they will need to repeat year 2, right? So in year 3, we have this end of posting assessment and also second professional exam. So if passed, then they can continue year 4. If fail in year 3, they have to repeat the entire year 3, seek for repeat exam. So if pass, then is if fail, then it's a termination. They cannot have second chance to repeat year 3 again. Right. In year 4, again, in year 4, like year 2, there's no major exam in year 4, but they have to achieve aggregate marks of more than 50 in all the continuing assessment in order to pass year 4 to continue year 5. Right. Year 5 actually is, again, we have continuous assessment and also final professional exam. So if the student pass the overall year 5, they are graduate as a medical students, graduate. And if fail, then we will provide the student 6-month remedial classes, right? Then after the 6 months, the student will require to seek for repeat exam. So if the student passed the repeat exam, the student will consider as graduated. If fail, then the student may deem have failed the entire course. Right. So this is the diagram to illustrate the medical training for our medical MBBS medical graduate. So after their 5-year program, they need to undergo 2 years of housemanship training in the Ministry of, in the hospital registered in the Ministry of Health. Only certain hospital, about 39 of them, are qualified to become HO training doctors. So they need to find the place to the slot, to do the housemanship training, and they will be given contract 2 years, to finish their housemanship training, right? So as I mentioned before, so when they are doing well in their housemanship, then may be possible that they will be given contract to continue to service in the government hospital for another few years. So at the time, when they start to actually have their MO training or MO service, they can start to think about whether apply for scholarship or plan to do their subspecialist training. Okay, so the following slide actually give you an overview about some of the teaching facility that we have in our FMHS UTAR. So this is the Ampang Hospital that I mentioned just now. So this is the major public hospital that we use for our year 3 and 4 training. And this is a skill training center over here. So we actually rented a shop lot, and the student can actually have their face-to-face classes, examination. We also have some computers being set up, in this training center, so that the student can actually have a rest and also look for information while they are waiting for their classes in the to be either conducted in the hospital or in the clinical skill center. Okay, so this is another teaching hospital we have. This is Hospital Kuala Lumpur. This is considered one of the major hospital in Malaysia. So this hospital have many medical school students actually coming here to have their medical skill training. So that's why this hospital is considered very, very congested. So we have some of our year 5 posting here, like for example, internal med and ONG posting, we are having some of it over here. And year 4, like psychiatrists posting, we are having it in Hospital Kuala Lumpur. So we have set up a clinical skill training center nearby the Hospital Kuala Lumpur in this MMA building, all right? Okay, so this is a new training center. We just moved in a few months ago, I think. So in the campus also, we have all these teaching and training facility ready to facilitate the student learning in terms of their theory as well as skill training, right? So we have this multidiscipline laboratory, we have medical museum, multimedia resource center. This is considered as a computer lab, right? Clinical skill lab, right? We have a simulation board, physiotherapy center, TCM center, teaching lab, and also postgraduate research lab. All right. So these are some of the facility that we have in the clinical skill center. We have stimulated ICU, we have stimulated hospital ward with bed and bed fitting, because this clinical skill hospital ward actually also is a skill training center for our nursing student, whereby infectious control isolation room, we have simulated labor room and nursery, we have treatment room and clinic room as well. So just to show you some of the pictures here, right? This is the simulation ward and this is the treatment room, right? This is the ward, this is the labor room, right? This is where we the doctors will examine the babies, after being born, right? So this is a clinical skill lab we have. We have bought a few mannequins to stimulators to help with the student training, clinical skill training. We have SimMan, which can actually, we can set different type of clinical condition, and the student can examine the heart, the different aspect, is like a stimulated patient here, And SAM, student occultation mannequin, we have a few in the clinical skill lab. We have Harvey mannequin also to help with the CVS skill training. Okay, so these are the facility, this is the pictures showing how our students actually doing the anatomy classes. We are using models here, but also I mean, now because of COVID-19, the students are all doing it online. So if they are allowed to come back to the physical setting, this is how the anatomy classes are being conducted. Right, so this is a multi-resource center whereby we have computers here lined up and the students are doing their self-directed learning, and the discussion over here, and this is the medical museum whereby we have all the models and all the specimen, and we have allocate some space for the student to actually do their group discussion. Okay, so again, this is a picture showing how the student actually practice their hand-on skill on their own friends, All right. So again, another picture showing how they are doing MSK examination, how to actually do the pelvic, examination. Okay, so this is the physiotherapy center that we have, all right. So this particular center also will be used by our physiotherapy students to do their training and practical classes. And this is traditional Chinese medicine center, right? This is also the lab that our TCM students are doing their practical and as well as free clinic. So our lecturer from the TCM department actually having a free clinic for all the UTAR and students, on various conditions. And also we have one exercise room in the TCM center because for them to do exercise for their tuina or classes. Okay, we have postgraduate research lab. All right, sorry for the typo here. So altogether we have one pathogen lab and one general research lab. So we have all the basic equipment to support the research, in all the basic science research in the faculty. Okay, this picture actually illustrates some of the activities that we have during our community health project. So in year 2, as you may recall, we have a community health project and community health service to different target group in the society. So over the past 10 years, we have actually have the community health project in different setting in the society, in the community, like new village, old folks home, preschool children, primary school children, secondary school children, university student, pregnant women, and factory worker. So these are some of the pictures that we actually taken while we are doing the activities, and this is the feast that we have organized to actually entertain the old folks people during the health promotion activities. Okay, so we also have educational site visit with the underprivileged sectors, during the family medicine course in year 4. So these are the sites that normally the student will have opportunity to visit and actually understand the health condition of this group of underprivileged sector. Okay, and also we have a white coat ceremony being organized after year 1 to actually encourage the year 2 student and also to inform the student that they have finished their foundation study, in theory based. So now they will start to embark on the clinical skill training, whereby they will have to adhere to all the rules and regulations and also the ethics that are required when they face the patient. So this is the picture illustrate the white coat ceremony taken during our first white coat ceremony back in 2001, I think 2002. Yeah. Sorry. Yeah, no, 2010. Sorry for my mistake. Okay, so next one, I would like to share with you some of the information about our recent exciting project on UTAR Hospital. So our faculty together, UTAR have an initiated a UTAR hospital, and the location of the hospital in Kampar, Perak is actually next to the UTAR Kampar campus in Perak. So it is a 500-bedded hospital, and for the first phase, we will first start to build the 215 bed first. Okay, it's a non-for-profit private specialist hospital that aim to provide up to premium service, medical service to the local community. So the UTAR hospital is ready, should be ready in December 2001, but I heard that because of COVID-19, there are a bit of delay. So, but anyway, the UTAR hospital, the first operation will be the TCM block will start to operate first, then it will follow by the Western medicine block. Okay, so this area, this image actually shows the location of the UTAR hospital. So this is the UTAR Kampar campus, and the UTAR hospital actually is situated in the area where we have highlighted in a red color box here. Okay, so if you want to know more about UTAR hospital, actually you can visit to this website. And the aim to set up this UTAR hospital is to provide affordable quality medical service to Western medicine, traditional and complementary medicine, as well as Chinese and Ayurvedic medicine to the local community. So currently, these are the progress so far. This is the medical block here. This is the TCM block, and these are the staff accommodation. So this particular TCM block will start to operate first, then followed by medical block. Okay. So we are actually now having a donation drive for the UTAR hospital, you know, and if you have a view to donate to our UTAR hospital, you can always take out your handphone and scan this QR code, and then make your generous donation to our project. Now, this donation will eventually use to support the UTAR General Development Fund and also UTAR Hospital Fund. So last part, I would like to talk about the medical education during the pandemic, you know, what we have done, you know, what we have adjusted our program, you know, to actually embrace what has been changed, what we cannot do, you know, during the pandemic. You know, so the aim for the medical education during the pandemic actually to allow the medical student to graduate on time. You know, hopefully, you know, shouldn't delay the medical student further, because also during the pandemic time, the country is very much needed on the frontliners to help to care for our patient. So one of the aim actually to allow our medical students to graduate on time, but at the same time also because during pandemic, all the face-to-face physical teaching are being not allowed, you know, in the training center, in the hospital, as well in the hospital. So how to ensure adequate training are being provided during the pandemic time? The training here actually is talking about the skill training, right? So there are a few questions being asked, you know, from different parties of different stakeholders is how to define the adequate, you know, and what is the best way to assess the clinical skill competency, you know, if we all go for online. How do we make sure that the skill competency is being achieved or whatever? So and also because during the pandemic also at the same time it is the time whereby our Malaysia education, the academic schedule, actually most of the school are having final exam, you know, for the medical program. So there are actually suggestion whether can make use of continuous assessment to replace the final exam, or because final exam it's involved like clinical exam, and at the time hospital the entry to the hospital are not being granted, and the student are actually forced to stay at home, and how and to carry out the final exam. That is one of the main debates at the time, you know, and whether continuous assessment can be used. So this is some of the questions that we may need to address. Can we use stimulated patients, mannequin, and hybrid SM with the real to replace with the real patient? How far can we use that? Can we just substitute all with the stimulated patient and mannequin, or can we actually conduct hybrid SM with the real patient? So all these are the questions raised, in order to answer the question like how to ensure this particular training are adequate during the pandemic time. So to adjustment that we have made actually during the COVID pandemic, actually the first one, the theory classes, as you all know, I think all the medical school, all the school in the worldwide actually has already converted all the theory classes into online classes. As in Malaysia, actually we start our online classes since March 2020. So of course, to do the online classes, we have to follow certain guidelines stipulated by the university as well as by the Ministry of Education. So all these are being in place. As to us, theory classes is not an issue, and in fact, we actually received quite a encouraging comment from the students saying that they prefer the online classes for theory learning because they can actually have a chance to review back some of the information delivered in the online classes using the playback video or whatever, and they can plan their learning time accordingly. So as compared to the physical classes. Okay, so for the skill training, so this is one of the major debates that we are having at the moment. At the moment also, the higher authorities still couldn't come to a conclusion yet, but all in all, we are talking about like for the skill training during this pandemic time, we will go for the stimulation. We use a stimulation mode to deliver our skill training. About 50 to 70% of the skill training will be done virtually. So these are some of the example how we actually translate the face-to-face training into stimulated mode, right? Like for example, for the inpatient scenario, we may have a longitudinal case stimulation over 3 to 5 days virtually, because the doctors are still, our staff are still allowed to work in the clinic. Perhaps also our staff will actually have a consensus with the patient, to have a virtual kind of practical session together with a real patient through the handphone or through the virtual platform. MiniX, they are doing it virtual outpatient scenario. For the skill-based stimulation session to be done on mannequin or video recording, we look at the video recording and the student may be allowed to do the mannequin to practice their skill on the mannequin. As to now, the access to the hospital are still being barred because, as you all know, in Malaysia, the COVID case has become more serious these few weeks. So the students are again not being allowed to enter to the hospital again. So, but again, we have received a notice from the higher ed, the authorities saying that for those important skill training, the student are allowed to go back to the campus to use the facility on their training. So these are the adjustment that we have made. So we may use the hybrid format in terms of our skill training, like we will show the student the video recording, and also the student may actually have a chance to practice their skill using mannequins. OT stimulation centers session, what we did actually, we have a partnership or collaboration with the surgeons, locally and international in the national hospital, to have a live streaming of the OT session, and at the same time also after the live streaming session, we have a debriefing session and hands-on session together with the students. Right, so these are the plan for the actual patient engagement. You know, of course, we emphasize the real patient engagement to the final year student also, because ultimately they will be the one that will be graduating soon, you know, to join the workforce in the actual healthcare setting. At the moment, even though the hospital, you know, hospital are allowed our student to have a posting, but the number for the student to be allowed to enter to the ward is actually quite limited. That's why we have this plan in place. Like we are talking like to give a priority for the final year student to have the actual patient engagement. You know, and also for the year 3 and year 4, we emphasize more on online and also skill training in the clinical skill lab. You know, but again, in year 3 and 4, if those particular postings are not going to be repeated in the final year, then we may actually have a replacement class or remedial class to make sure that the student have enough exposure with the real patient. I think that's all from me today, and hope I have give you a brief introduction about medical education in Malaysia. Thank you for your attention. Stay safe and healthy. Thank you.
Yep. So thank you very much, Dr. Leong. Student, if you have any question, you can type in the chat box. Or you can unmute yourself and you can ask verbally. If no question, then I'll end the session. Oh yeah, there's one question. Is it? Yeah, there's one question on the chat box.
Sorry, I try to, okay. Okay. So there is one question in the chat box. Because of the pandemic, the society may need more doctors. So do Malaysia still need to tighten the number of medical graduates? Yes, at the moment, no, to answer this question, yes, at the moment, we may still need to tighten the number of medical graduate, because firstly, actually is we still haven't solved the problem, like the training for the medical students, you know, and we are still have a lot of students, like over 1,000 of students still waiting to start their houseman training, and until we solve the problem, like to provide proper or enough slot for the HO training, I guess the government will loosen the regulation again. But at the moment, I think the policy, their stand still firm on tighten the number of medical graduates. Yeah, the policy actually starting 5 years ago, and the timeline given is actually until end of this year, 2021. We will see what is the progress so far, because according to the report, actually the government has already engaged with certain private hospital to allow the student to have their training there, and also they have evaluate their public hospital, and they have actually increased the number of public hospital that they can actually also provide training to the HO. But until this end of this year, then we will know what is the final verdict, no, from the government, whether they will continue to have the policy like no quota increase, no medical school to be registered in the Malaysia. Yeah. I hope I have answered your questions.
So student, do you have any other question? So if no, then I will end the session. So thank you very much, Dr. Leong, for the exciting sharing session today. So I believe our students have learned a lot from you. So once again, thank you very much. And we also like to thank the student who joining the session. So now all students, please kindly turn on the camera for the group photo session. Dr. Leong, you can stop share the screen.
Stop share. Okay.
Yeah.
Yeah.
Mm. Okay. Okay, any other student who can open the camera, you can open. Or you can't open, you can press the reaction button and give me a thumbs up. Okay, ready? I'll take the screenshot for the first page. Okay, ready? Give me a thumbs up. Ready in 3, 2, 1. Okay, give me a minute. Okay, I'm going to page 2. So all students, once again, give me a thumbs up. Okay, ready? In 3, 2, 1. Okay, give me a minute. So I'm going to page 3. Okay, so once again, give me a thumbs up. Okay, ready in 3, 2, 1. Okay. Okay, done. Okay, thank you very much to